And welcome back to Life Unrehearsed. I'm Matt Delvecchio, specializing in life transitions, elder care planning, and the senior living industry. If you're just tuning in, Life Unrehearsed is now on Sundays from 4 p.m. to 5 p.m., the original time slot when I started the show 6 years ago. And just think, next week on the show, the clocks will have changed. Sunset's going to be around 6:45 p.m. I just love it. Hey, what about sparking up the barbecue? Tune in to Life Unrehearsed. Put on some sunscreen. You get the picture. Well, someone who also gets the picture is our next guest, Joanne Photiades. She has a perspective on life that perhaps not many of us do. And Joanne is an ovarian cancer survivor and proud mother of 6.5-year-old twin boys. She's the co-chair of the MUHC Foundation's Dream Big, Stop the Silent Killer campaign. We just heard from Dr. Lucy Gilbert all about this. Joanne is part of a team working hard that has raised more than $2 million to bring early diagnosis to people with endometrial and ovarian cancers. Joanne, welcome to Life Unrehearsed.
Hi, Matt. Thanks so much for having me again.
Yeah, thanks for coming on. It is International Women's Day coming up on March 8th. And, I was thinking of you because we're going to talk not just about your story, but also your family story as well on the second half of this interview. So let's talk about, you had ovarian cancer. Can you bring us back to the time, I guess, when you were even trying to get pregnant, I guess?
It was this exact time, actually, in 2015. We were trying to start our family, and I wasn't feeling very well. It was also around the time of Lent, and I had given up coffee that year. So when I had started drinking coffee again, I realized that I had a frequent need to go to the bathroom. Always had to pee, and I had to go more often. And at the same time, I felt like I'd get really full when I would eat quickly, and I had a lot of abdominal bloating, really tired, lower back pain, but all symptoms that you could easily dismiss because they're so subtle. So I kind of dismissed them.
And then you had some discussions with your doctor, and you knew in your gut that just something wasn't right. And I know you're a big advocate for really pushing to get some answers, and that's exactly what you did, didn't you?
I did, because that's exactly right. I did some blood tests, and they came back normal, that everything was okay. And I was like, you know what, there's something more to this. So I had an ultrasound, and that's when they discovered that I had a 10 by 12 centimeter mass on my left ovary. And so I went to see a gynae oncologist, and he dismissed me because I wasn't considered high risk. So yes, I did have to advocate for myself. And I had the great fortune of meeting Dr. Lucy, as we call her here. And right away, she put me on standby for surgery and told me something was not going well.
And things moved quite quickly. Listening to Life Unrehearsed, Matt Delvecchio here, and we're talking to ovarian cancer survivor Joanne Photiades. Now, Joanne, I can't believe the size of this mass, and you're still fighting. They're dismissing it kind of. Dr. Lucy jumped in. So what is involved in the process of removing the mass?
Well, from my first ultrasound to surgery, my first surgery was about a month, and it grew from 10 by 12 to 18 by 20 centimeters and weighed about 10 pounds at the time that they removed it. So it was quite aggressive and growing very quickly. And they were able to remove all of the cancer. As aggressive and big as it was contained, so it hadn't spread to any of the other organs. So they were able to remove it via surgery. And then they did a second surgery about a month later to check if it had jumped to the lymph nodes, because that's the first thing we do. So they removed about 25 of my lymph nodes in the pelvic area to see if it had spread anywhere before it jumped onto another organ.
Major operation. And just for time context here, this is back in 2015. So how old are you at this time, Joanne?
I was 38.
38 years old, so young. And I guess part of the reasoning for asking this, because I believe you had no children at the time. I think you always had that dream of having children, and you're 38, and so did that dream end because of this?
Absolutely not. And yes, I was 38. We were just getting married, excited about starting our family, and then we got this news. So I didn't let the dream end. All of the doctors thought that it was very aggressive. And the only thing they knew for sure, it was very rare, so they weren't really sure what to do. And they couldn't predict what would happen next. The only thing that they knew was that it was going to come back, and it was going to come back within like 18 months maximum. So they wanted to do chemo, and they wanted to do a full hysterectomy. And of course I said, no, I'm having kids. So most of the doctors at the tumor board thought it was pretty crazy, probably. And Dr. Gilbert supported me. She's like, look, it's up to you. I'll support your decision. And so I had a few months to get pregnant, because I had to get pregnant and give birth and have hysterectomy all within 18 months, right? So that's what we did. And by some miracle, it's actually Christmas Eve, we found out that we were pregnant.
It's amazing. I cannot believe the pressure you and your husband were under at that time. That 18 months window, and just going through this major operation in cancer. So you ended up having the news you were pregnant, and you ended up being pregnant with twins. Is that correct?
That's right.
And when were they born?
They were born in August 2016.
August 2016. Lucas and Nicholas.
Yes, that's right. Lucas is named after Dr. Lucy Gilbert.
Oh, really? I hope she knows that. If not, we would have got to bring her back on the air.
She was there when he was born.
Really? Okay. You know what? Feel a good story. Now, 2023. That's six and a half years ago, I guess.
Yep.
Now back to you. How are you doing, and what do you have to go for annual tests, or how does that work out?
I did have a hysterectomy a month after the boys were born, just to make sure that I eliminated the risk of it coming back. And I did quarterly checkups up until the pandemic hit. So I'd have blood tests and CAT scans or PET scans or MRIs. They would alternate every quarter pretty much, and had that until the pandemic hit. And then I didn't have one for a few months, and they actually did find a growth at one point during all of this in 2020. But it was okay. It was growing, but it wasn't cancer. And now, as of last summer, Dr. Gilbert actually fired me. She's like, I will see you at fundraisers, but you don't need to come in every quarter anymore. So I'm just going to be followed up on an annual basis.
That, I love the term. You got fired, and you probably never wanted to be more fired in your life, I guess, Joanne. Congratulations. That's really good news. Nothing like being fired. Now, you obviously take this to heart. You've raised and been involved as a co-chair of the MUHC Foundation's Dream Big, Stop the Silent Killer campaign, raising over more than $2 million. You're an advocate. Here's a soapbox for you, Joanne. Scream out, what should women know in terms of symptoms and signs to watch out for?
Really watch out for the symptoms. I said, if you have any one of those for more than 3 weeks, I beg you, go see your doctor, because like I said, it happens so quickly and it spreads so quickly, and you don't want that to happen to you. You want to catch it early. So really, abdominal bloating, a frequent need to go to the bathroom, early satiety, fatigue, lower back pain, like all of that together, it's not usually a good sign. And I'm so passionate about paying it forward to Dr. Gilbert, and lucky because they caught it phase 1, but it shouldn't come down to luck. And the 5-year prognosis for ovarian cancer is like 10 to 30%, and it's because 75% of the ovarian cancers are diagnosed in phase 3 or 4. But if you catch it in phase 1 or 2, the prognosis changes to 80 to 90%. So it's super important that you catch it early, and that's why this test is so important to become standard care. Yeah,
it is. And Dr. Gilbert doing some wonderful work with her team there. All right. We have to head out to traffic, Joanne, but I just want to make sure you still are the co-chair of the MUHC Foundation's Dream Big, Stop the Silent Killer campaign. If people want to contribute to that campaign, where do they go?
They could go to the Dovey website on the MUHC. There's a page there, and there's also my personal page. If you go to my Instagram page, Joanne Photiades, you'll see a link in my bio there as well.
Okay, wonderful. Thank you very much. We're going to have you stay on the line because, it is International Women's Day coming up, and you represent not just being a cancer survivor, but you also are the voice of a parent, a mom. We're going to talk about your twin boys, and one of them with a rare developmental disorder. And we're going to have you put on your mom hat for us, Joanne, when we come back. Welcome back to Life Unrehearsed. My name is Matt Del Vecchio, and we're talking to ovarian cancer survivor Joanne Photiades, and there's no stopping her now. Absolutely not. You just heard her story about the whole trials and tribulations of ovarian cancer, surviving that, beating the odds. One of the challenges, Joanne, that you had, you were 38 years old and you didn't have children. You always had that dream of having children. And then all of a sudden you found yourself in this window of about 18 months of having to get pregnant. And you did, as you've explained. So you ended up having children. Tell us about the birth of your twin boys.
Oh, it was just magical. It was a great day. They were born. They were healthy. They were small, but they were healthy. And Dr. Gilbert was there, making sure that the cancer didn't grow while I was pregnant. And it was a great day.
I could imagine. I mean, you usually hear moms saying it's a great day, and I think you certainly bring a different perspective of that term.
Oh, yeah.
It was a great day, Joanne, I'm
Best
sure.
day ever.
And as you mentioned, you ended up having to have a hysterectomy a couple of months later. Why was that again?
To eliminate the risk of the cancer returning.
Okay, and then you had that done, and bringing up two boys, you and your husband Dennis, and as the boys were growing up, you started to notice maybe something might not be right with one of the boys. And what were your thoughts at the time?
Well, all throughout the pregnancy, there was one of the boys that was developing at a slower rate than the other one. And it depended from week to week, because I was being followed every week, and he'd always be about 10 to 40% smaller than his twin. And being a twin pregnancy, they would say it's typical. There's always one getting more nutrients and not to be too worried. And then when he was born, they were both around 4 pounds, so low birth rate, excuse me. But whereas Nicholas was feeding really well and meeting milestones, we just couldn't feed Lucas. It was so challenging. It would take 2 hours to drink half a bottle. He just wasn't swallowing and having a really hard time feeding him. He was very fussy. He had some inguinal hernias and an umbilical hernia that he had to have removed, which he actually had surgery a couple of days after I had my hysterectomy. So that was a wild week. But he was just developing slower, and he was missing milestones, and the doctors kept telling me once again that it's typical with twins that one's developing faster than the other. But when he was 18 months, he wasn't even crawling, never mind walking. And I started really pushing the doctor, he's missing some important milestones here. Let's do some tests. And
then you ended up doing these tests, listening to Life Unrehearsed, and Matt Del Vecchio with Joanne Photiades, ovarian cancer survivor, and now talking about, I just can't imagine just listening to you having your hysterectomy, that your son, one of the two twin boys, having an operation. Now you're pushing because something just isn't right, and you finally get a diagnosis, don't you?
Oh, honestly, Matt, he started walking at 28 months. We had started physio earlier on, around his first birthday, to try to help him. He had really low muscle tone, and we were trying to help him develop that, help his gross motor skills. But then he started walking at 28 months, and we figured, okay, so he's just on his own curve. He's small, and he's got low muscle tone, but he's getting there. He's developing, and the doctors kept saying that he would catch up by the time he's 5 years old. And then what happened was, just before the pandemic hit, he had a sinus infection, an ear infection, and we needed to get some antibiotics. So we went to see the doctor again, and that's when she said, actually, that heart murmur that he was born with should have closed up by now, and it hasn't, so I want you to go see a cardiologist. So we really thought nothing about it. We went to see the cardiologist that day, and it was that day, literally 2 weeks before the pandemic hit. He's like, have you guys heard about Williams syndrome? And of course, we had never heard about it. And it was from that moment on that we started trying to get the diagnosis.
And so he is, if I'm calculating, around 3 years old now at this time?
Yeah, he was 3.5.
3.5. And you hear this Williams syndrome, and you probably did not know what that is. So you've obviously been involved, done a lot of research. This is 3 years later. Can you maybe describe what Williams syndrome is and how prevalent is it?
Um, well, it is a rare genetic condition, and it results from the spontaneous deletion of like 26 to 28 genes, depends on the person, on chromosome number 7. It occurs in 1 in 10,000 individuals in all genders and all cultures around the world, which is also the same likelihood of finding a 4-leaf clover. So we always say that we're really fortunate and blessed to have them in our family, because as much as there's health issues and cardiovascular disease and developmental delays and difficulty with visual processing and learning disabilities, people with Williams syndrome also have this very unique ability to spread joy. They are known to have a cocktail party personality. They love without fear. They smile endlessly. They have sparkly eyes, and they just challenge perceptions with exceptional courage and strength. They're just very different.
Different is right, and we were talking off air, Joanne, and I want to really bring this up because, it does take a village to help, someone with special needs. In your case, Williams syndrome, I'm a father of a special needs young adult, and I could certainly attest to, taking a village. I know your husband, Dennis, not only, supporting you from your ovarian cancer challenges that you've had, but as a parent as well. So you don't give up. You really don't give up, Joanna. That's what I love about you. And so can you just explain the importance of advocating for your loved one when, Mama Bear speaking here, something's not right. And what can you do to tell our listeners to really push for answers?
Well, if there's one thing you could take away from this interview, it's definitely the importance of early detection and always advocating and going for second and third opinions. In our case, it was really important to get an early diagnosis and start that therapy, because one of the big things with him is both his delayed development. He has delayed fine motor skills and gross motor skills. So that's why he didn't start walking until he was 28 months, which is actually a little early for a lot of kids with Williams syndrome. A lot of kids start walking a little later. And you want to start that therapy because like his balance is off, for example, right? So if he's sitting in a chair and he's in fight or flight mode because he's scared he's going to fall off, he's not going to be able to sit in a kindergarten classroom and learn, right? Because he's afraid he's going to fall. So the earlier you start that therapy, the faster they're able to learn as well. If that makes sense.
Yeah, no, absolutely. And I want to also address, because I use sometimes the terminology correctly or incorrectly. A normal kid or a normal adult versus not normal. And you corrected me in one of our pre-interviews, and I really liked what you said. Can you explain to our listeners why that perhaps is a mistake to say normal, not normal?
Oh my God, it drives me bananas. I don't believe in normal. I think there might be typical, but not normal. I think he is made exactly the way he's intended to be. I've learned so much from him. There's nothing wrong with my child. I think the world is not designed for people with disabilities in mind, whether they're physical or invisible disabilities. And it's not a world that's accessible to him. So I'm constantly advocating to make sure that he's in an inclusive classroom and that he has the resources he needs, and to always presume competence and that the sky's the limit. Like, it's going to take a lot longer and a lot more resources and a lot of patience. But there's so much these kids could do if they have the right support. And I'm just trying to normalize, if I may say, getting that support. And it's like wearing glasses, like you can't see, you get glasses, you don't think anything of it. So same thing in a classroom. Give him the resources and support he needs, and he's going to be set up to succeed in life.
Well said. Well said. Well, Joanne, I want to thank you. We're already out of time, but really want to thank you for taking some time here on a Sunday with us.
Thank you so much for your time.
All right, that's Joanne Photiades, who fought her way through ovarian cancer and is the mother of her beautiful twin boys, Lucas and Nicholas. Next week on Life Unrehearsed, Are you putting the necessary plans in place as you age? And we're going to have an elder care planning expert, Kirsten Bennett, on the show. And dying on your terms, the growing popularity of medical assistance in dying, a very sensitive and popular topic that we're going to address. We've got an expert coming on the show next week. Thank you for tuning in to Life Unrehearsed. As a reminder, for all your inquiries or assistance with life transitions, elder care planning, and the senior living industry, it'd be my pleasure to help. You can find out more. Just look us up under Lianas Senior Transition Support. That's Lianas, Lianas, Senior Transition Support. Many thanks to our technical producer, Dario. Great job today. You can listen to Life Unrehearsed here on CJD 800 now every Sunday at 4 p.m.